Have you ever asked yourself, if your heart stopped beating while no one was around, what would you do? It sounds extreme, but it's not far-fetched. In America, a lot of people live alone, and not being prepared for that situation can turn a heart attack into the end. Most of us think, I'll have time to call someone, I'll have time to get help. But sometimes, reality doesn't match that thought. In those first few minutes, it's the very small decisions that can keep you alive or not. I'm sharing this because I've felt that myself. A sudden pain, paralyzing fear, and a cold, clear awareness that no one else but me would decide what happens next. I know this isn't something everyone wants to think about, but thinking about it could save your life. You don't have to be a medical expert. You don't need a fancy clinic. You just need a simple plan. Recognize the signals your body is sending as a warning. Decide right away to call 911, no waiting. Know how to ease the burden on your heart. Know how to turn those first minutes into the most precious time to survive. In this video, I'll share 7 basic steps, not from a textbook, but from what I've learned after seeing too many people who didn't have time to react. This is my real-world perspective, not theory. This is what I want anyone, no matter their age or situation, to be able to own. What to do when there's no one else there, and your chance of survival depends only on you. There's one more thing I want to say before we go into the details. These simple steps don't mean you have to do it all by yourself. They just mean you know what to do before help arrives. And just knowing that and preparing for it is enough to change the outcome. So ask yourself, are you ready? Don't wait for your body to speak up. Don't wait until it's too late. Let's start together right now. Number 1, listen to your body's first warning signs. Picture this. It's a typical morning. You're sitting on the porch, sipping coffee, soaking in the fresh air. Suddenly, you feel something unusual in your chest. Not a sharp, stabbing pain like you might imagine, but a dull pressure, as if an invisible hand is pressing against you. Most of us tend to ignore that feeling. Maybe it's just indigestion, maybe it's just some heartburn, we think. But the truth is, heart attacks don't always come like they do in the movies. Instead of intense pain, they can start as a sudden shortness of breath, a fatigue you can't explain, or a dull ache you've never felt before. I once talked to Sam, a 68-year-old neighbor. One morning, while pruning his garden, he felt a slight tightness just below his breastbone. At first, he thought it was from bending over too long, but a few minutes later, he realized his hands were slick with sweat, and his breathing was shallow and strained. He didn't brush it off like before. He sat down, stayed calm, and called 911 right away. Later, the doctors told him that his quick thinking had kept his heart from more serious damage. When it comes to heart attacks, don't just focus on chest pain. Pay attention to any strange feelings, like sudden breathlessness for no clear reason, or pain that spreads to your arm, neck, or back. For older adults and women, the pain might not even feel like chest pain at all. It can be more like pressure in the stomach or back, which can easily be mistaken for digestive issues. Don't wait until you collapse like in a dramatic movie scene. Don't convince yourself it's just old age. Your body often whispers before it screams, and it's those whispers that are your only chance to act early. When you feel a combination of tightness in your chest, shortness of breath, and unexplained fatigue, don't ignore it. Don't try to keep going with your chores or tough it out. I know that in America, a lot of people pride themselves on being independent and thinking, I'll be fine. But sometimes, the wisest thing you can do isn't to keep pushing through. It's to listen to your body, stop, and keep yourself safe. Number 2, call for emergency help right away. Don't delay. If you think you might be having a heart attack, don't try to wait a little longer to see if it gets better. Don't try to be tough or come up with reasons not to bother other people. Pick up the phone and call 911 immediately. This isn't just the fastest way. It's the most important thing you can do to give yourself a chance to survive. I've heard many Americans, especially those who live alone, say they hesitate to call for help in case they're just overreacting. But with a heart attack, there's no such thing as overreacting. The heart can't wait for you to calm yourself down for another 5 minutes. I remember once talking with Mrs. Helen, 72 years old, a family friend. She said, one morning she felt a dull pain spreading to her left shoulder. She thought about calling her daughter, but then she remembered what a nurse friend had told her. If you're alone and you feel something's wrong with your heart, call 911 first, sort everything else out later. That call saved her life. When the paramedics arrived, they found her shaking and sweating cold, but they had the equipment and medicine to stabilize her heartbeat right on the spot. Many Americans think, I'll get to the hospital faster if I drive myself. But in reality, that's one of the most dangerous decisions you could make. While driving, the pain could knock you out, cause an accident, and you might not even make it to the hospital. When you call 911, they're not just bringing an ambulance. They're bringing skills, medication, and a chance you wouldn't have if you were driving alone. One important thing: you don't have to be 100% sure you're having a heart attack to call 911. The dispatcher won't be annoyed if it turns out to be a false alarm. They would rather come and check than miss the chance to save your life. I always keep my phone in a spot that's easy to reach, right on the kitchen counter or beside my bed. Some phones have an emergency call shortcut even when the screen is locked. Look it up ahead of time and remember it. Even if you can't speak clearly, you can still press that emergency button. This might sound obvious, but in the middle of fear, many people forget or hesitate because they're afraid of making a fuss. Don't let that fear hold you back. Hesitation can take away the precious minutes your heart needs most. Number 3, chew an aspirin slowly and stay calm. Right after calling for emergency help, the next thing you can do and should do is grab an aspirin right away. Don't swallow it immediately. Chew it slowly, even if your hands are shaking. Why chew instead of swallow? Because chewing helps the medicine enter your bloodstream faster. When a heart attack starts, your heart is starved for oxygen, and aspirin can help blood flow more easily, enough to prevent further damage to your heart before the rescue team arrives. Remember, if you have a standard 325 mg aspirin, and you're not allergic to it, and aren't already taking blood thinners, chewing it immediately could be the difference between life and death. This isn't some random tip. It's what doctors and EMTs in the U.S. advise patients to do if they suspect a heart attack. I once talked to Mr. John, a veteran living alone in Ohio. One evening, while he was watching TV, he felt a slight pressure in his chest. He didn't panic, but he didn't ignore it either. He called 911, then remembered his doctor's advice. If the pain could be a heart attack, chew an aspirin right away. Mr. John said that single aspirin, along with his timely call, kept him alert and gave him enough time for the paramedics to arrive in time. One important note I always share with my friends: don't use enteric-coated or extended-release aspirin. If that's all you have, you should still chew it, as long as you're not allergic. Yes, taking aspirin on an empty stomach can feel uncomfortable. But if a heart attack is underway, your biggest worry isn't your stomach, it's saving your life. Make sure you always keep aspirin somewhere easy to grab. By the bed, in the kitchen drawer, or in your coat pocket. In the U.S., a lot of people live alone, and just 1 or 2 aspirin tablets in the right spot can be the golden window before the ambulance arrives. This isn't some far-fetched idea. It's a small step you can take yourself, and it could decide whether you get to call your loved ones again or not. Number 4. Sit or lie down to reduce the load on your heart. After calling for emergency services and taking aspirin, the next step is crucial. Stop all activity immediately and find a safe sitting or lying position. While waiting for help, the most important thing is to reduce the strain on your heart, because every movement, no matter how small, makes the heart pump harder to circulate blood throughout the body. Something it's no longer strong enough to do well when it's low on oxygen. Find a sturdy chair, the edge of a solid bed, or even the floor if there's nowhere else to sit. When sitting, make sure your back is firmly supported by the chair or the wall, with both feet flat on the ground. Avoid crossing your legs or pulling them up, as that can restrict blood flow. Don't hunch forward or tense your shoulders. These rigid postures only make your heart work harder. Let your arms rest on your thighs or along your sides, keeping your shoulders loose. If you feel dizzy, you can carefully lie on your side, using a pillow or a folded blanket under your head to keep your neck from bending and to ensure your airway stays open. Sitting or lying still helps your blood flow more easily and eases the workload on your heart, limiting further damage to your heart muscle. Many people think, I need to move a little to feel less stressed. But in reality, staying still is the best thing you can do at this moment. In just these first few minutes, your heart can hold on to enough oxygen to keep your brain and other organs alive until medical help arrives. One of the most common mistakes is trying to stand up and keep going to finish up what you were doing or tidy up a bit to feel better. But it's exactly those actions that can drain your energy and make things worse. Remember, this is not the time to worry about appearances or feeling like a burden. This is the time to stay as calm and safe as possible. Once you're seated, focus on your breathing. Don't let fear or panic take over. Breathe in slowly through your nose for a few seconds, hold for a count, then exhale gently through your mouth. Controlling your breathing not only helps you stay calmer, but it also limits how fast your heart beats from fear. This is especially important because when you panic, your body releases stress hormones like adrenaline, which cause your heart rate and blood pressure to spike, forcing your heart to work even harder. If you're sitting on a chair without armrests, be careful not to slip or bend forward. Find something solid to lean against, like a wall or a sturdy surface, so your back and lungs don't get compressed. Keeping your back straight and your body relaxed helps you breathe evenly and avoids putting extra pressure on other organs. I also often recommend that people who live alone prepare in advance. Always have a sturdy chair or safe sitting area near the phone or somewhere easy to reach in case of an emergency. This preparation may seem small, but when a heart attack strikes, it can save you from panicking to find a safe place to sit. Lastly, and most importantly, remember that sitting or lying still doesn't mean giving up or doing nothing. It's how you help your heart keep going until professional help arrives. Don't underestimate this. Every minute you sit and breathe slowly, every second you avoid an unnecessary step, is another heartbeat you're holding on to. And sometimes, those heartbeats are the difference between being alive and having no chance left. Number 5. Unlocking the door so emergency responders can get in. Once you've called for help and settled into a safe position, there's another crucial step that most people don't immediately consider: unlocking the front door. At first, it might seem trivial, but when your heart is racing against time, every second can mean the difference between being saved in time or having no chance at all. Emergency responders always carry tools to break down doors, and they're trained to do it as safely as possible. But no matter how prepared they are, breaking a door still takes time. They have to find a leverage point and make sure they don't injure you or themselves while doing it. Meanwhile, every second that passes is another second your heart is fighting to pump blood through a blocked artery. Unlocking the door ahead of time is how you buy yourself those precious seconds. And in emergency medicine, even 1 minute can determine the extent of heart damage, or even life itself. If you feel a heart attack coming on but still have some control, take a moment to look around and ask yourself, do I have the strength to stand up? If you do, get up slowly, keep your breathing steady, and use a chair or the wall for support to prevent falling. Once you get to the door, make sure you don't just unlock it, but crack it open a bit, just enough so that emergency responders can see it's no longer a barrier and can gently push it open to get in. In those moments, there's often a mix of panic and determination, the feeling that you have to do something. Many people have shared that unlocking the door helped them feel calmer because they felt like they were actively working with the emergency team instead of just waiting. Others worry about the inconvenience of letting strangers into their home, forgetting that this is not the time to think about privacy. However, if you're feeling too lightheaded, or if every step leaves you gasping for breath, stop. Don't risk collapsing just to unlock the door. A fall at this point could be even more dangerous than a locked door. In those cases, the safest thing you can do is sit or lie down and focus on your breathing. The emergency team will still get to you. They know how to handle locked doors. Your job is just to focus on keeping your heart beating steadily and your body getting enough oxygen. Being prepared ahead of time will save you from panic or confusion when an emergency happens. Ask yourself, is my door easy to unlock from the inside? Is my address clearly marked? Do I have a trusted family member or neighbor who has a spare key? If you live alone or have a chronic condition, you might want to consider installing a smart lock or an outdoor key box, something that medical personnel or a family member can access when needed without having to break down your door. I remember once hearing a story about Mr. Nam, a man who had a heart attack while home alone. He shared that after calling for help, the first thing he thought of wasn't finding his medication. It was unlocking the door right away. When the emergency team arrived, it took them just one push to walk in with nothing in their way. He said, "When I unlocked the door, I felt like I wasn't a helpless victim anymore. I was someone who still had a say in what happened next. And maybe that's what helped me survive." Finally, remember, unlocking the door is not a trivial task. It's a way to show you've done your part. The rest is up to the people trained to save you. Treat unlocking the door as a core part of your survival plan, just as crucial as calling for help or chewing aspirin. When time is the enemy, an unlocked door is how you fight back and give yourself a better chance. Number 6. Use the speakerphone or your phone's medical ID feature. When a heart attack strikes and you're alone, your phone isn't just a communication tool anymore. It becomes your most critical lifeline. After calling for emergency help, the very next thing you should do is turn on the speakerphone immediately. It's a small action, but it can make a huge difference. While you're waiting, holding the phone to your ear forces you to tense your shoulders, neck, and back, right when your heart is already straining to pump blood through blocked vessels. Even gripping the phone too hard can make your hand shake or cause you to drop it if your body starts to weaken. With the speakerphone on, you can relax your hands, sit back more securely, and focus on keeping your breathing steady, something absolutely vital at this moment. The speakerphone also helps the dispatcher hear you more clearly, especially if you start to speak in a weak or broken voice. They can pick up on other sounds, like your labored breathing or quiet groans, that are critical signals they use to assess how severe the heart attack is, even if you can't describe it well. This isn't just a comfort tip, It's a safety tactic. When your breathing is rapid and your chest hurts, even holding something for too long can stress your heart further. The speakerphone lets you keep your phone close without straining. You can set it on a table, next to your chair, or right by your thigh if you're seated, as long as your voice still comes through and you can hear the dispatcher clearly. Besides the speakerphone, don't forget another feature that can literally save your life: the emergency medical ID on your phone. Most smartphones have this feature. It stores basic medical information like your name, age, existing health conditions, medication allergies, current medications, and emergency contacts. On an iPhone, this info can be accessed without unlocking the phone, just a few taps on the lock screen. Android phones have similar features. Why is this important? In a critical situation, you might not be alert enough to answer even basic questions. For paramedics, having just a few key details can completely change how they care for you. They'll instantly know if you're allergic to certain medications, if you're on blood thinners, or if you have medical conditions that require extra caution. I heard a very real story about a woman named Lan, 79 years old. That day, she was home alone and suddenly felt a tightness in her chest. She managed to call for help, but just a few minutes later, she passed out. When paramedics arrived, they unlocked her phone and instantly saw that she had diabetes and a severe allergy to a specific antibiotic. That helped them avoid giving her the wrong medication, and more importantly, they immediately called her daughter using the emergency contact already saved. Setting up your medical ID only takes a few minutes. Enter your name, birth year, any allergies, the medications you take, and 1 or 2 emergency contact numbers. You don't need to be tech-savvy, just willing to do it once. It's silent information that can speak for you when you're too weak to do it yourself. Once you've turned on the speakerphone and are sitting still, let the dispatcher guide you. Trust in their calm voice and firm instructions. It's not just medical advice, it's also a way to make you feel less alone and less scared. And if you can't speak anymore, your phone, ready with your medical ID, will still speak for you. It's not a minor detail. It's part of your plan to save your own life, a part only you can prepare in advance. Number 7, slow your breathing to keep your heart beating steady. During a heart attack, it's not just the crushing chest pain you feel, it's also the panic that nearly swallows you whole. Each heartbeat seems to pound in your ears, your breathing becomes rapid, and your mind starts to spin. In those moments that feel endless, there's one tool you always have: your own breath. If you know how to use it, it can't heal the heart attack, but it can help keep your body from slipping into a worse state of shock, at least until emergency help arrives. When you panic, your heart rate often spikes because of stress hormones. Blood rushes to your brain and lungs, making it even harder to breathe and easier to feel faint. In that moment, slowing your breathing is the simplest yet most effective way to pull your heart rate back to a safer level. It not only stops your hands from trembling so much, but also helps keep oxygen flowing to your heart, preventing it from wearing out too quickly. You don't need to know any complicated breathing techniques. Just go slowly in a steady rhythm. Try this. Breathe in slowly through your nose for about 4 seconds. Pause for a moment. Then exhale slowly through your mouth for about 6 seconds. Repeat. Focus all your thoughts on that rhythm. Just one thing: breathe evenly, slowly, and deeply. This might sound small, but it gives your body a stable anchor. Steady breathing signals to your nervous system that you're no longer panicking, helping bring down your heart rate and blood pressure. While you're waiting for the paramedics, this is the only way to stop your heart from falling into dangerous rhythms that stress often triggers. I remember Mr. Duck, 83 years old. One afternoon, he felt a crushing pain tightening around his chest, not like a sledgehammer, but like an invisible hand squeezing tighter and tighter. His hands shook, his breathing became fast and shallow, but then he remembered the breathing exercise his doctor had taught him. He closed his eyes, focused on the slow in-and-out breaths, and shut out everything else. When the rescue team arrived, his heart wasn't back to normal, but it was still beating steadily. It hadn't gone into an arrhythmia. At that moment, I only thought, "Stay calm, breathe, stay alive," he shared after he'd made it through the crisis. You can practice this breathing technique anytime, while resting, feeling anxious, or even just watching TV. Regular practice makes it second nature, so that if a heart attack really does strike, you won't be paralyzed by fear. You'll be able to focus on the only thing you can truly control: your breath. Breathing won't fix the blocked blood vessels, but it can buy extra time. A few crucial minutes your heart needs while you wait for medical help to arrive. During a heart attack, sometimes those few minutes are the line between life and no more chances. Treat this slow breathing technique as a vital part of your self-rescue plan. The one thing you can actively do, even when everything else is out of your hands. Saving yourself isn't just luck, it's readiness and calmness. In those moments when a sudden heart attack strikes, many people think, "I can only count on luck." But the truth is, surviving that situation isn't just a miracle. It's a mix of understanding, preparation, and the right actions fitting together like crucial pieces of a life-saving puzzle. The 7 steps you just learned, from recognizing the warning signs, calling emergency services without delay, chewing aspirin the right way, sitting or lying still, keeping your door unlocked for paramedics, using your smartphone wisely, to slowing and steadying your breathing. Each has its own purpose. Every single step buys you precious moments. Each small action is part of a self-rescue strategy. No step is unnecessary, and none should be skipped. More importantly, these steps don't require complex medical skills or expensive equipment. They require you to sense when your body is sending out alarms, to trust your survival instincts, and to stay calm enough to do the right thing at the right time. In those brief minutes before help arrives, you are your own and only first line of defense. You might ask yourself, "Am I really ready? Do I know how to sit in the safest position? Have I kept aspirin in an easy-to-reach spot? Am I sure my loved ones know how to use my phone to find my medical info if I can't speak?" Answer those questions now, not when there's no time left to get ready. A heart attack often comes suddenly and brings an overwhelming sense of loneliness. But these steps are your reminder that you can still take control. Even if no one's there to help, you still have the tools, the know-how, and a bit of calmness to keep your heart beating for another minute, another heartbeat. Remember, you're not powerless. Every step you take is proof that you're still fighting, not waiting for luck, but actively buying yourself the chance to be helped. And once you're ready, share what you've learned today with the people you care about. Because someday, you might be the one to remind them that no one is truly alone when they're prepared and take action. We're grateful you spent this time with us today, and we'd love to hear what you thought, what you learned, and what you're planning to do. Share the one thing you think is most important, or one step you'd never considered before. We read everything because every share isn't just a boost, it's part of building a community of people learning how to survive, how to be strong. If you found this video helpful, please like, share, and subscribe so you don't miss new content. It's not just a way to support us, it's a way to spread life-saving information to others. Thank you for being here. Stay calm, stay ready, and keep believing that you're never truly powerless.